Hello, Dr. Sharad sir. Welcome to the show. So today we will be talking about cervical cancer and its preventable methods. So my first question to you will be, as cervical cancer is the most preventable cancer over the world, yet India continues to account for a significant share of global burden. Why do you think this gap exists?
See, in India, every 7 minutes, one lady is dying of cervical cancer. Second thing is, it is the second most common cause of cancer in women in India. And globally, this is the third common cause of death in women. So India contributes lot of load as far as cervical cancer is concerned. Your question was why it is so. One thing is we have started giving HPV vaccine now. It is available for over a decade in Western world. And secondly, the hygiene of Indian women is poor, one. And secondly, even if they have some complaints, because initially cervical cancer will be asymptomatic, except for some bleeding or vaginal discharge, there will not be any symptoms. So, the hygienic care by the Indian women is lacking, and HPV occurs because of the various reasons. One is the risk factor associated with multiple sex partners. Secondly, smoking and other factors. Some people are genetically prone to develop cervical cancer. So those are the various factors. That's why the load in India is more. The most important thing being that people are not taking vaccine and the hygiene is not taken care of.
Okay. So, as we talk about cervical cancer, many people know that what is cervical cancer, but very few people know that it is caused because of virus. So, can you explain what is HPV? How does it lead to cancer, and why does that mean this disease is preventable?
HPV is human papilloma virus. There are several human papilloma viruses. They cause various types of cancer. Cervical cancer is one of them. There can be anal cancers, there can be oral cancers also, and there can be perineal region cancers. So these are the various factors. Now it is a human papilloma virus is transmitted from male to female during the sexual act. So it is there in the prepuce of the humans, and there are some types of viruses which when entering into a female body, they will remain there for a long time. They are not eradicated and they cause chronic inflammation. And because of chronic inflammation, the chances of developing cancers are high. So that is how the papilloma virus causes this cancer, cervical cancer.
Okay, and how does it prevent?
Prevention is we should screen the women for vaginal discharge. What happens is generally when they come to doctors, and if the doctor is male, they do not tell about the leukorrhea or discharge. What they tell the doctor is the general weakness or backache. But doctor has to guess that she is having this leukorrhea. Second thing is when she is having this complaint, we should do the vaginal examination and take a swab. We can find out whether it is candidial or trichomonal, and look at the cervix. If the cervix shows white lesion, then it should be the pap smear should be taken, and if the smear comes positive, then we can take the cone biopsy, so that the diagnosis of cervical cancer is made, and depending upon the stage, we can offer the surgery. So the patient can be cured of the disease if it is caught early.
The government of India deserves immense credit for initiating the vaccination to 14 years of age, but there is still a large cohort of girls aged 15 to 26 who remains unvaccinated. How important it is to address this gap?
Ideally, the vaccine should be taken in the two doses between 9 to 14 years of age. If somebody has not taken the vaccine between 9 to 14 years of age, idea is to take the vaccine before first sexual contact. Now, if they have not taken the vaccine, then they have to take 3 doses after the age of 15 years. So that can be given, and it is available, and it is manufactured in Pune, and it is available at affordable cost. And government is giving in their immunization clinics free of cost. Now, You asked me about the population which is between 15 to 26. So as I said, any girl volunteering in for the vaccination should be given 3 dosages, 1, 2, and 6 months of age. Now, what some organizations are doing is they are going to the colleges and screening asking the girls, adolescent girls, and young students in the 11th and 12th to come forward and take the vaccine. And they come and they are responding to this, and they come and take the vaccine. So gradually the susceptible cohort is going down. Regarding the mothers who have never taken any vaccine and they come for delivery, after the delivery, when before the baby and mother goes home, seek an opportunity and give 1 dose of vaccine at least to these mothers. So that is how we can take care of the vaccination from 15 to 26. Regarding the later age, because they are already exposed to HPV and they have been infected, so there is when we give vaccine 2 doses or 3 doses, 80% are protected. If they are already exposed to HPV, then the protection rate goes down. So there is no point in giving vaccine beyond 26 of age.
Yes. So, when we talk about vaccination on a larger scale, how can healthcare institution and civil society organization work along government to ensure that awareness and access reach young women between 15 to 26 years of age group who otherwise is left behind?
So my earnest request to all the real makers is that please don't do any propaganda against the vaccine. I have heard that somebody has done a reels on going against the HPV vaccine. The vaccine, when it was being done, there were some deaths in the community, and the vaccine was unnecessarily blamed. Later on, it was found out that there was no association of vaccine with the death. So this vaccine, when it's during trial stage, also faced a lot of resistance. Now, once the government has approved and the DCGI has approved this vaccine, the vaccine is ready to be rolled out. Then people are making some funny reels and doing anti-propaganda. That should stop immediately, because by doing this, the person making reels is also compromising the health of his wife, his sister, and his mother. So I appeal to these people that a vaccine does not cause sterility, and vaccine protects them against cancer. So that is the benefit of the vaccine should be taken.
Yes, so my next question was about the influencers, because there are many videos we can see going online, which is claiming that HPV vaccine causes infertility, which is obviously wrong, and millions of families have heard about it. So how can we ensure that families make informed decision based on science and not on fear?
Yeah, that is the most important thing. And so, in an educated family, it is very easy to convince them. Educated patients come after doing the search on Google, so it is easy to answer their questions. But sometimes their questions are very long and detailed. But then we don't hesitate to answer the questions. This the problem is with the illiterate and uneducated people. If they get swayed by this the propaganda, then they will not reach the vaccination centers and will not take the vaccine. So as we did it in the case of polio eradication, we went to the community, we went to the society, and we, like film star Amitabh Bachchan actively campaigned, Muhammad Kaif actively campaigned for polio vaccine. Similar things should be done by the film stars or by the sports persons, so that that message will, if you and me telling the people, will not be accepted, but if Virat Kohli tells everyone, they will accept it. So that is how we
Yes.
should do it.
Sure. We will try to make some
Make-
videos with them as well. So, WHO has called for the elimination of cervical cancer as a public health problem. Looking at the population of India, how realistic is that goal for India?
Yeah, it is possible. It can be achievable. What we can do is, between 9 to 14 years, we can target the school population from 5th to 8th, 9th standard, give the vaccine. Then, when they come in the college, junior college, that's the opportunity. If they have missed out on vaccination, we can offer them the vaccine, and we conduct the camps in the colleges and give the vaccine. That's the second thing. Third thing, when the mother comes for antenatal checkup, inquire whether she has taken HPV vaccine. We cannot give it in the pregnancy, but the delivery is registered and the register is it is followed up on government portal also. So that mother, to ensure that the mother gets the HPV vaccine before she goes home, we will cover the most of the population. So that is how we can go. And once we routinely give vaccine to 9 to 14 years, then the children less than 9 years will come up to that age and they will take the vaccine. So this process will go on.
Yes, sure. When we talk about access and affordability, it remains a significant challenge in India due to its population and poverty level. So, how can CSR partnership and private sector engagement accelerate protection for more girls across India?
CSR can fund for the vaccination of some girls, like in one of the NGOs where I am one of the directors. We collect funds from philanthropists and we give thousands of doses. We have already given 52,000 of doses of HPV vaccine. Similar things should be done by other NGOs and they should collect the money and give the vaccine. So that if we do for next 5 years, I think cervical cancer will disappear from the.
Okay. When we talk about HPV vaccine, we only think about girls, that HPV vaccine is only for girls. But now WHO has introduced 9-valent vaccine, which protects against 9 strains of HPV, and which can also be given to boys. So, why does vaccinating boys matter? And what role can they play in breaking the cycle of transmission?
Vaccinating boys is important because boys are the source of HPV. They are giving it to the girls. So if we give it to the boys, then they will not transmit papilloma virus to girls, and they will not that will not lead to cervical cancer. It's as simple as that. As I said, along with oral cancer, lip cancer, and anal cancer, all these and laryngeal cancer, they are all caused by papilloma virus. So all such cancers in boys also can be prevented if we give vaccine to boys.
Okay. So, as we conclude this interview, what is your message to the millions of girls, young girls, who have not yet been vaccinated?
My message to them is don't get swayed by the influencers and their reels, and stop using the mobiles for seeing the reels. First thing, the contact with the mobile should be less than 2 hours. As I am pediatrician, I always advocate that. And thirdly, what is good for your health, you should decide, not somebody else should decide. So you people should make a strong decision that I am going to get vaccinated and going to protect myself. Because once any cancer affects the family, and if it is in the advanced stage, surgery, chemo, radiation, the whole family is disturbed and the whole family goes below poverty line. Thanks to present government's policies and Ayushman Bharat and other areas, the help is being given. But sometimes some drugs are not under the scheme, then we have to buy it and they are expensive, absolutely expensive. So I think taking vaccine is simple thing. If you take vaccine, rest assured 80% of the times you will be protected if you did not have sexual contact before taking vaccine.
Yes. So, thank you so much, Dr. Sharad. We had a very great time with you and the insights you shared with us. I hope after seeing this video, many girls will take vaccine.
I hope so. And I today I had 2 interactions with Neha as well as Alisha. With Neha regarding tuberculosis, and I want to say that tuberculosis is a very rampant disease in India. As I said, it affects 3 to 4% of population every year, and rich and poor, everyone is vulnerable to get tuberculosis. So we should be aware of it. You should not be scared of it. We should take complete treatment, and you should not go for diet fads and to look thin or to look pale or fair. You should not eating some these things. That's not good. You have to have balanced diet, and that does not mean you should take protein powders. You should take natural diet, and that will be good to fight against tuberculosis. Regarding HPV, as I said, every girl from 9 to 14 years should receive 2 dosages. They are available on the immunization centers. Government is giving it. If you can't get it, come to the NGOs like us, and we will definitely make provision for the vaccination to all the girls in 9 to 14. If you are beyond 14 or 15, then you can take 3 dosages and protect yourself. Simple as that. This you should do before you have first sexual contact, because HPV is a sexually transmitted disease. Thank you very much.